Method for open and endovascular perfusion of the head and neck. This procedure is performed on patients with unresectable brain tumors and exhausted options for systemic drug therapy. It represents an implementation of high-dose localized drug therapy, enabling the concentration of therapeutic agents in the tumor region to reach levels unachievable with systemic therapy due to toxicity limitations. The video demonstrates an experiment conducted in 2021 on non-human primates, whose carotid artery anatomy differs from that of humans. The procedure is performed under general anesthesia and systemic heparinization with coagulation monitoring. To allow for potential repeated interventions and minimize trauma to the carotid artery walls, a vascular graft is sutured into the wall of the internal carotid artery to provide access. Next, vascular bands are applied to the branches of the aortic arch, represented in primates by the brachiocephalic trunk and the left subclavian artery, to occlude blood flow to the head, neck, and upper extremities. Using interventional radiology techniques, an intravascular occlusive balloon catheter is introduced via the right femoral vein to block blood flow at the orifice of the superior vena cava. A cannula for the return segment of the perfusion circuit is positioned in the superior vena cava via the right jugular vein. Arterial cannulas for the inflow segment of the perfusion circuit are inserted into the internal carotid arteries through the implanted vascular grafts. The external components of the perfusion circuit include a cardiopulmonary bypass machine comprising a roller pump and an oxygenator. The perfusion circuit is initiated. Initially, it operates in a parallel circulation mode, where the upper body's circulation remains connected to the natural cardiac output. The cardiovascular system is allowed to adapt, and the medical team ensures the stability of hemodynamics and vital monitoring parameters. Subsequently, vascular bands are sequentially tightened on the right and left branches of the aortic arch. The balloon catheter in the superior vena cava is then inflated. At this stage, natural and artificial circulations are separated, and the head is perfused exclusively via the cardiopulmonary bypass circuit. A high-dose therapeutic agent is then introduced into the isolated perfusion circuit. Depending on the protocol, drug perfusion may last from 10 to 60 minutes, with other durations also being feasible. After the therapeutic perfusion, the organs and tissues within the artificial circulation are flushed with an oxygenated solution containing prepared erythrocytes, colloids, crystalloids, a buffering agent, and albumin. The flushing process lasts 5 to 10 minutes and requires up to 3 liters of flushing solution. Finally, the vascular bands on the arteries are released, the balloon catheter in the superior vena cava is deflated, and all vascular cannulas and catheters are removed. Heparin is neutralized using a protamine solution under coagulation monitoring.